Miles.
Chris, I think you're next.
Chris Belts, Campbell County Health EMS in Gillette.
Thank you. Russ?
Russ Christensen with Casper College.
Thank you. Phil?
Philip Franklin, Cody Regional Health.
All right. Scott?
Scott Murphy, ambulance director, North Britain Hospital.
Welcome. Jeremy. Jeremy is from Converse. He is not able to talk to us, but he's here from Converse. Let's see. Steve, did I get you?
Stephen Root, ambulance manager, Wyoming Medical Center.
Welcome, Steve. William?
William Kramer, South Lincoln EMS in Kemmer.
Okay, cool. Shauna? Shauna, can you hear me? No. No. We've got like a Mickey Mouse sound coming from.
Shauna Pena is the unit manager for Rural and Frontier Health. She's our boss.
Yep. I have someone, is this you on the phone, Phil, or someone else? 828-474-9861.
My name is Maya Robinson, and I'm with South Lincoln Medical Center.
Hi, Maya. Welcome. And then Ian, I think you just joined us.
Yes, I did.
And where are you from?
Cheyenne, Wyoming.
Yeehaw! We're Wyomingites all here. All right, let's go ahead and get started. Just so you're all aware, I am recording this. I am recording it so that something just weird happened to my computer, so that I can share it with other people. You should be able to see my shared screen. Please let me know if you can't. However, something weird just really happened.
We don't see it yet.
Okay. I am not sure what just happened. What about now?
Yes.
A purple sheet?
Yes.
Okay. So today is Wednesday, June 27th, 2018. The reason why we are all here together today is to talk about the Emergency Medical Services Sustainability Project. And so I'm kind of backwards here, but I'll just keep going. So the project that we kind of worked on between the Office of EMS and the Rural and Frontier Health Unit was this Community Emergency Medical Services, or CEMS. For the purposes of this conversation today, I'm just going to call it Flex CEMS. So what is the Medicare Rural Hospital Flexibility Program? And I'm sorry to do this to y'all, but I have to stop share one more time. Yep, we're good. So I'm not really going to go into it, but I did include this link here. So it talks, this is the National Rural Health Center. It does talk about what the FLEX program is, how long it's been established, where it came from, why it exists, why it's going to continue to exist. We focus mainly, and it's right here, the FLEX program focuses on quality, financial, and operational improvement at critical access hospitals. We also look at rural EMS, and we help with population health. That's the focus of the FLEX program. So one of the things that happened was some additional funding came our way specific to EMS, EMS sustainability projects, and so therefore we're going to look at the FLEX CEMS. This next section that you see right here, this is my disclaimer. I pretty much have to put it on everything. It talks about where this money comes from. So it comes from the Health and Human Health, and let me start again, Health Resources and Service Administration through the Department of Health and Human Services. This disclaimer gives all the information that you need. My grant number, how much money we had in the grant this last year. It will change for this upcoming year, but this is where the funding is coming from, this area right here. So the purpose of the Flex CEMS is to meet the goal of ensuring access to quality health care in Wyoming's rural communities through community emergency medical services. That's our purpose. So what is that? So CEMS agencies provide direction for integration of EMS personnel in addressing specific gaps in communities' primary and public health care systems. Activities of Wyoming CEMS include reducing the burden of patients accessing the larger healthcare system through emergency medical systems. Community EMS agencies may utilize either community EMS technicians, or CETs, or community EMS clinicians, CEC, to perform defined and regulated activities. So what are those? So I'm going to go here. This is the Wyoming Department of Health website. We go up here to divisions. We come here to emergency medical services. This is just so you can locate it. And then we scroll down here to rules, regulations, and EMS, etc., or trauma, etc. That brings up our rules, our EMS rules and regulations. So we're going to go here to this one. This is really important for all of you. I want you to be able to find this, easily access it. You're going to need it as you move forward with your CMS projects. This outlines the roles, rules, and responsibilities of community EMS practitioners, agencies, education, and programs. So this is where you're going to find the meat of what we're trying to do. Obviously, it gives us the authority. It provides us definitions. It tells us about how you're going to earn your endorsements for your licenses and who can currently attain one of these endorsements on your license. So really important information, tells you all of the steps. This is going to be really important when you're looking at your education program that you want to go into. So what do you want to do to get certified? So you want to look at this. And once again, whatever educational program you choose to go to get certified, it's going to have to be approved through the Office of EMS, and they're going to look at these standards. Are they meeting these standards for this? And there's a lot you can see through that. And then Section 5, Community EMS Technician and Community EMS Clinician, so CET and CEC, Scope of Practice and Authority, your agency approval requirements, and then documentation and reporting. So you want to make sure that you can get to that quickly and easily. You might want to print it out. It's going to be very useful in helping you further the direction of your CEMS program.
Hey, Kyle, if you want to copy that link and put it in the chat box, and then people can go in and just download it from there?
Sure can. Thank you for suggesting that. That might take me just a minute, but I can do that.
I'm not sure I know how, but I've seen it done.
Well, I'm not sure I'm going to be able to do it real quick. Yeah, I am. Thank you guys for being patient while I do this and I get this link in here for you. That should work, right?
Yeah, thanks.
You're absolutely welcome. Again, just you want to be able to get to that link really quickly and easily so that you can have that information that you need. So what is the Flex CEMS project? And this is going to move up for me. I think of it as 5 steps or 6 steps maybe, but at this point for the project, it's really just these 4. The first thing that your EMS agency is going to need to look at is a facilitated community discussion, including the agency and healthcare partners on the interest and implementation of a CEMS program to determine gaps in service. This is something that your agency is going to need to coordinate through the Office of EMS. They do have Gary Wingrove on contract, and so we're going to hopefully continue to utilize him. The point of these facilitated community discussions is to get as many of the healthcare providers in your community, whether it's home health or behavioral health or whatever it is, to come together and talk about what the identified needs in the community are and how this CEMS program is not going to step on anyone's toes or overlap anyone, but actually offer additional services to meet the health needs in the community. So we want that facilitated discussion to make sure that we have the buy-in in the community to really make this a successful program. That's number 1. Number 2, we're going to offer peer-to-peer training by visiting an EMS agency that has an implemented CEMS or community paramedicine program. So 2 people and 1 alternative from each agency to go and be a part of and shadow and understand what other CMS agencies are doing that's really successful. And that will be through the Flex program. But we'll coordinate that between you guys and through the Flex program and Office of EMS, just to make sure we can get the right fit, get you at the right location, and get you learning and observing what you need to observe to be successful. Then the third part of this is scholarships for education towards the ET or CEC endorsement. So what does that look like? Well, we talk a lot about community paramedic certification, and that's fine, just as long as we all realize that when we translate that into Wyoming, Wyoming is not a community paramedic program. Wyoming is a community emergency medical services program. And so there's that kind of overlapping. But again, you're welcome to go to any program. I mean, there's a budget, we're not going to pay $50,000 or whatever. There's a budget in there, but you're welcome to go to to go to a program that best meets your needs, as long as it meets the requirements and the approval of the Office of EMS. So we're not going to tell you which program to go to, but flex funds are there to pay for 2 people from each of the 3 agencies to attend probably what's going to be community paramedic certification program. And then the last thing I have right here is these activities can run concurrent with each other, but they all have to be completed by August 31st, 2019. So it's not like, well, I can only do 1 or I can only do 2. No, we're trying to create a sustainable CEMS program in your community, and we feel like these are some of the steps to do that, to really make it work and really make it something that it just becomes part of your community health care. What are the requirements? Well, first off, you need to be a licensed rural EMS agency in good standing. So if you're not in good standing with the Office of EMS, if your license is in wavering or any kind of problem, probably shouldn't apply. You probably should get that taken care of first. But as long as you're Wyoming licensed and you're in good standing, we're good to go. The next step then is just to apply for funds and receive approval. So I have money for 3 EMS agencies to do this program. And I have sent out this application. So it's a I tried to make it a simple application. And I had other people trying to get me to make it as simple as possible. So the beginning of the application, there's 6 parts to it, just kind of talks about what the program is and what we're going to do. You have to put in the normal information. Section 2 is about the facilitated discussion. Section 3 is about the peer-to-peer training. Section 4 is about how you're going to get the certification program to get your endorsement for your license. Section 5 is the measures that you're required to report. And then Section 6 is why. Why should we look at you? Why should you do this? Why is it important for your community? So I think it's a pretty quick and easy application. We may ask for follow-up information. I think one of the things that's been mentioned to me is some sort of letter of commitment from the people who are going to go into the community paramedic training. Some sort of guarantee that yes, this person is committed to seeing this through and wants to help establish it in the community. So that's the license. It is due to me by midnight, Friday the 13th. Because I realize that we don't all work 8 to 5, and sometimes saying, by close of business is not good. It's much better to be able to say, no, I can do it by midnight. So it's due by midnight, Friday, July 13th, 2018. Probably within a week, by July 20th, we will have made our decisions about what 3 agencies we're going to go ahead and assist with the flex funds. And to make that happen. So reporting requirements. There are some reporting requirements. That's always a big deal. It's a really big deal with my Flex program. We collect all sorts of measures and we use those measures then to determine where we're going to use our funds or what we need to do for financial or quality improvement. It's the same with this program. So one of the things, I work with critical access hospitals, and one of the things that we talk about a lot at our critical access hospitals is reducing readmissions. I think we all know that. So that is our first measurement. And then we want to know how many transports to the local rural hospital you're making. Now, we're not expecting any change in this data. It's simply a baseline so that over the course of you know, the first 5 years of you establishing your CEMS program, we can use that as our baseline. This is where we were at before. This is where we're at now. There's some communication with your local hospital there on getting those numbers. And then the other piece of reporting that we would like is one additional agency relevant measure. So what's relevant to you? What's relevant to your community? What do you see as that need that you can measure, that you can start out with a baseline number, and then you can measure it over the course of the first year and then over the course of establishing your CEMS. The baseline is the readmissions rate. I do need the previous 6 months. We'll look at 6 months in the middle of the year, and then we'll look at 6 months at the end of the year. I'm not expecting any change in that. Again, that's just to establish a baseline. And just want to put in this very big reminder that all projects must be completed between September 1, 2018 and August 31st, 2019. I think it's doable if you're committed to it. I don't see any reason why it couldn't happen. So, you know, it's a year. We can do this in a year. Results. So this is what we're happening. And I know that other communities are working on this, but for the Flex CEMS, we'd like to see 3 Wyoming EMS agencies operating as a CEMS. We'd like to see 6 EMS personnel with a CET or CEE endorsement on their license. And of course, we want to prove access to health care in Wyoming's rural communities. So we all have our stories about the need out there. And I can share a couple too, but the one for me is the story of the elderly man who had been on his ranch his entire life, and now it was time for him, you know, he was passing, he was moving on, except that moving on to the transitioning, whatever you want to say, he was dying. That particular experience was really hard on his wife and his children. And it was time to take him to that nursing home, and that action of trying to get him to the nursing home or the assisted living facility caused huge trouble and strife and anger for that family. Certainly, if a CEMS could have come into that house and eased that transition, or just offered that additional support and love and care and consideration and hope to that family, it might have eased that transition and might have prevented that family discord. That's my story. I'm sure you guys all have your own stories as well. Results. I am trying to. Hello. So then finally down here, I hope you guys can still hear me. Sometimes, let me see if I can do this real quick. Sometimes that causes problems. So contacts information is right here. I am Kyle Cameron. I am the Flex coordinator. Andy Guynap is the manager of the Office of EMS. Scott Logan is the EMS licensing coordinator, and Shauna Pena is the manager of the Rural and Frontier Health Unit. And I can tell you that all of us here at the Wyoming Department of Health, Public Health Division are here to support you in any way we can. We are working together to make this happen. If we feel like it's all something that's very, very important to us. So now, do you have any questions? Concerns, thoughts, hope?
This is Russ and Casper. You said you were recording this video. Will this video be able to be accessible by us that are attending so that we can reference it, show it to our higher ups so that we can garner support for this type of stuff?
You know, I really hope so. Because it's a Wyoming Department of Health video, sometimes it's a little difficult for me to share, but I want to be able to share it. That's why I'm recording it, and I want you to be able to share it.
Okay, thank you.
You're welcome.
Kyle, this is Scott Murphy.
Hi, Scott.
Is there a way you could apparently I don't have that email that has that data that off that sheet. Could you send that sheet to me?
Sure. Could you write your email in the chat box?
Sure.
Are you saying the application you don't have?
Yeah, I'd like to have that letter that that piece that you showed us on the screen, and I don't have the application either. Maybe Logan has it in the business office or something like that, but I need some way to get to that. So.
Okay, just write your email in the chat box.
I'm trying. I can't seem to get in there, but I'll keep trying.
Okay. If you know what, you can just tell me it.
Sorry, I muted myself here. It's S Murphy, Murphey, at N as in Nancy, B as in boy, H as in Henry, H as in Henry.com.
Okay.
S Murphy at nbhh.com.
I think I have. Okay. Thanks, Scott. Will do. Okay. Phil, I'm seeing your email here too. I'm seeing, okay, cool. I'm seeing a couple. Okay. Yeah, if anybody else doesn't have the application or the information, just go ahead and put it here and I'll get it sent to you. Any other questions, comments, thoughts, concerns?
What? Can you hear me, Kyle?
I can hear you.
One thing that I think we need to look at, we talked about once the individual or whoever gets the grant or whatever, you sign an agreement to ensure that they're in the community. I think that agreement needs to be with the facility, not the individual.
Why is that?
Because if you don't have the backing of the facility to provide such a service, how are you going to, as an individual, how are you going to provide the service? Because you're going to have the medical backing of your medical director at a certain agency. You see what I'm saying?
I hear you. How about everyone else that's on the phone? Anyone else want to comment on that? Should it be a commitment from the facility?
I have to agree with Philip, because I think to hold the clinician or the technician to that standard, if facility doesn't back him, he really has no other place that he can operate. So to hold him, I think you need it. I get holding him because if he gets in the middle of it and doesn't want to quit, there has to be some teeth there. But I think without the commitment out of the sponsoring facility or whoever they work for, I think we're kind of holding them at bay for something that may be out of their control.
And what would you suggest we do to make sure that the facility itself really has the buy-in?
My thing would be is if they drop buy-in on it, maybe a percentage based on how much time or effort was spent into it, that they would have to pay part of that back. I mean, I know as a grant coordinator, that's not what you want back. It's trying to get rid of it. Exactly. But I think there has to be some teeth somewhere that says, hey, this is a 13-month, a 12-month, or whatever month commitment.
Yeah.
Out of the service or out of the administration that's in charge of that service. Because once they get in the middle of it and all of a sudden they don't like something, or it's not working out the way they thought it was, where they can't just pull the plug. There has to be some sort of, some sort of bite there to make them stay in it.
As a coordinator, can you not put them on probation from receiving future grants for a certain period of time if they don't follow through with it?
Yeah, I can just whip them with a wet noodle. Absolutely. And so everyone who's on the phone here, I think that you're here right now because you have a commitment. And I think that other people who see this video or who are going to make the effort to see this video or learn more about this program, they're going to do it because they have a commitment to the health of Wyoming's rural communities. So I think you're here because you're committed. Is there going to be repercussions if an agency is chosen and they don't fulfill it? Absolutely. You're going to have to pay back every cent that I've given you, or not me, every cent that the Flex has given you. That will be written into the grant agreement. But the opposite is true too. So you need your agency, you need the facilities and the administration of the facility, and you need your community support. But what about that EMT person or that person we send who, 9 months into the program decides to move or decides to quit or decides it's not right or decides whatever. I mean, what are your thoughts about that?
I think it might depend on the reason. For instance, if somebody becomes ill or incapable of fulfilling that commitment, that's one thing other than just saying, you know what, we're tired of this, we want to do something else.
You're right. There's always those extenuating circumstances where something happened and somebody has to leave the community and uncontrollably.
I mean,
Anyone else?
you have to take into consideration what if somebody, like if you have a termination or something in the middle of the project, and that's one of your two clinicians that you are just getting started with. I mean, it's hard to hold the clinician for that if he was released for some other, had nothing to do with the program. It could be a disciplinary action within the service itself, you know.
So I would say that those have to be taken. Charlotte, did you want to say something?
No, I was just thinking, so this is kind of inside shop talk here between me and Kyle, and Shauna would understand this, but something similar to what we do with lonely payment. You know, people default for a variety of reasons, and there's certainly leniency if it's beyond someone's or an entity's control. So yeah, you can incorporate language along that line.
Right, in the grant agreement with the agency.
Right.
Any other comments about having some sort of guarantee that the agency is going to fulfill their commitment?
No, I don't remember right off the top of my head, but I believe if you go back into Chapter 14
right.
of the rule, Chapter 14 specifies the support that is required from the facilities and the community physicians and the other people involved in order to even implement a CEMS program. So that would be some of the teeth there. I would imagine that with a hospital-based EMS service, because the hospital is paying salaries and stuff essentially, they're probably going to be a little bit more involved and a little bit more committed to seeing the success of this also.
I absolutely agree. I agree.
One other point that I have a question of, I mean, 13th, the amount of time to try to put this together, just saying, or you've got a holiday week in the middle of there. So do we have to have this meeting with shareholders done before that application goes in then?
No. None of this has to even start until September 1st. But because I'm going to have to write grant agreements or contracts, and we want them in place by September 1st, I don't know how many of you guys have dealt with our contracting process, but it takes a while. So I really got to get those contracts started going as soon as possible. That's why the short deadline. I don't think there's anything on the application that's really too difficult. I think it'll take you about 20 minutes, but all the three projects, the facilitation of the community discussion, the peer-to-peer training, and the certification for the CET and CEC, that all happens between September 1st and August 31st, and they can happen concurrently. So, you know, you've got somebody in a program, they're doing that. You're going to work out the time that they can go to peer-to-peer training, and then you're going to also work out the time when you can have that community facilitation. So they all three happen concurrently.
And the maximum amount of that grant is $11,009 per agency.
Yes.
Okay. I guess when you had the grant application up there, I was like, well, do we have to have this meeting before? So basically all we have to get is a commitment from administration and 2 people committed to take and do the program, with a third as an alternate.
Right. And who are you going to send to who's going to be certified?
Okay.
Who's going to get the education? Who are the 2 people in your community, in your EMS agency, that really show the knowledge, skills, abilities, and have the other experiences to really be successful as a community EMS, who really understands the purpose and has a commitment and a drive to fulfill it? And I would say, you know, look at that. And if you don't feel like you have 2 people, it's, you know, you always need an heir and a spare. So if you don't feel like, well, we maybe have one person who's really committed, look, it's not going anywhere. This isn't, I mean, this is this project for this year, but I'm pretty sure, I feel very confident that money is going to continue to exist for this program because it is such a vital need in our rural communities. And, you know, and I think Casper College is going to go ahead and continue to develop a program so we can stay right here in the state. We don't have to go anywhere. So it's not going anywhere. This is just the first year that the Flex program is working to help bring these CEMSs to local communities. You know, my hope, my desire would be that this is something that will continue for the next, you know, whatever we need it to continue to, so that we can build this in more than just 5 rural communities.
If this Flex program starting in September, when do the people start schooling for this?
Right.
It all
So,
has to be completed by next August. Is there going to be time to? I don't know how long the program takes, and will they have to enroll before they're accepted into the Flex program?
no.
Okay.
Like I said, I'm going to turn this around pretty quick. So hopefully by July 20th, it might take till July 27th. You'll know if your agency's been approved. You can start looking at your program and start being prepared to start school September. That's the other reason why I have to have these grant agreements in place. You know, you can be ready to start school September 1st.
Most programs are 2 semesters. The ones that I looked at, Hennepin College is 2 semesters, and it's $2,400 for both semesters.
20 each semester, or together they're that much?
No, to get the total program is $2,400.
So, okay. So Jeremy Littleton of Converse said, I think when we were talking about the facilities and the facility and the personnel buy-in, he said it certainly improves chances for success. And then he also said having someone with expertise to speak with stakeholders and administration to help have a better understanding certainly helps. And we agree. And that's why we want to bring, and I'm pretty sure it's going to be Gary Wingrove, into your communities to make sure that your administration, your stakeholders, your other community healthcare partners are all on the same page with this, and any discussion, any fear, any concerns, any apprehensions can be discussed and worked on as part of the project. Thank you, Jeremy, for adding that. Anybody else have any comments, anything else they want to talk about? If not, I'm going to go ahead and close the meeting. What I want to just say is let's all work together to prevent suicide in Wyoming. Thank you for joining us.